Hi, my name is Dr. Giselle Martin, and I am applying to the Culture of Health Leaders program. So there are a variety of different issues that we are all aware of as health educators. You have drug and alcohol abuse, or like issues in the built environment, such as lack of sidewalks and dilapidated parks, roads that need to be fixed, um, social support centers or churches and community centers in different neighborhoods. Then you have the social determinants of health, like access to health care and health status as it varies by zip code. Let's see what else. We have education. We have the lack thereof. We have the lack of dissemination of medical and scientific research back into the community, which also goes hand in hand with the education. Um, we have crime and safety, and we have food deserts, um, and an organizational, I'll call it restructuring, that needs to take place. And so, what this would look like is we have the adequate tools, we have the research, we have all of these things. But what happens is that organizations have been operating in silos for so long. We need to partner together, whether it's uh, partnerships between public and private sectors and nonprofits and businesses and maybe even the federal government or city governments, creating policies and initiatives that will help drive businesses back into disenfranchised communities. Um, let's see, we have churches, local and state governments, and nonprofits, especially here in Baltimore. There are a significant number of nonprofits that do fantastic work in the community. However, we work alone, and uh, there's strength in numbers. We can do more work if we join forces together. Um, some of the relationships that should be formed specifically within different disciplines would be medical researchers partnering with city planners or school officials or a lay health educator, and actually pulling community members into the healthcare learning community, as I call it, where they are ambassadors to go back into their communities to help spread the health message. So these are just some of the things that I believe that we need to do as health leaders to change